Hey guys, welcome to another health talk with me, Bokamoso Mthimkulu. So, I'm going to tell you about a condition known as congestive heart failure or just heart failure. It is very difficult to understand as well as to explain. So, if you don't understand anything that I'm saying, please do leave a comment so that I can clarify any things that I've said that did not make sense to you. But I promise I will try my best to explain it in a nice and simple way. Okay, let's get started. Is to supply the body with oxygen-rich blood by pumping it to the rest of the body. Now, in heart failure, your heart is not working effectively in terms of its function. And so there is an imbalance between supply and demand between the heart and the body. Now, with heart failure, generally starts on the left side of the heart. And as it progresses, it can lead to heart failure on the right side of the heart, leading to this backlog of blood or congestion. So now with heart failure, you have two problems that can happen. And the first one is that your heart may fill with enough oxygen-rich blood, but may struggle to contract strong enough, because it is a muscle, to contract and to pump all that blood back into the body so that the oxygen and nutrients can be sent to the different organ systems. Or your heart may not be able to relax enough so that it can fill with enough blood that is oxygen rich so that it can pump all that oxygen rich blood to the body. So those are the two main problems that can happen with heart failure. And when this happens, that part of the heart now becomes filled with too much blood that just stays behind. And this can lead to that backlog of blood flow because the system still does what it has to do in terms of going to the body, coming back to the heart, going to the lungs, going back to the heart and going to the body. But now because it's still filled with so much blood, it can only hold so much blood. And so then when it cannot hold anymore, that backlog begins. So I'm going to use an example of you filling a balloon with water to sort of demonstrate what happens. So your hands are going to be the muscle being able to contract and pump all the water out of the balloon. The balloon is that part of the heart, and the water is the oxygen-rich blood. Now, think of a situation where you fill the water into the balloon and it fills nicely, but your arms are not strong enough to pump all that water out into the outside of the balloon. What happens is you have a lot of water that remains in the balloon, and then when you have to refill it, you can only refill so much, but you still struggle to pump all that water out. And so that volume increases and increases to a point where it starts to spill over out of the balloon. That is the congestion. In the second situation, what could happen is that you are given only 2 seconds to fill the balloon. So now in those 2 seconds, you can only fill so much. And so the balloon is not relaxing enough, but you're still able to pump all that water out. That volume that you have after you filled the balloon, because after it had, as it hasn't relaxed enough, is still not enough oxygen-rich blood to go to the body. And so even though you are filling, you are still getting a little bit. Same as if even though you're filling a lot but only pumping out a little, you're still getting a little of it out to the body. And those situations can cause this backlog. So the symptoms have been put up next to me, but now let's look at why you're likely to experience this. If you think of the pipe that is blocked, in one area, it causes congestion there, and then it causes a backlog of congestion throughout the entire pipe. That's similar to the body. When you have congestion in your heart, it causes a backlog of blood, which causes congestion throughout the entire cardiovascular system, or heart and circulatory system. Now, this allows for fluid to be retained in specific areas of the body. And so what you will experience is swelling or fluid retention, mainly in your ankles and feet, your hands, and there can be a lot of swelling around the stomach area as well. Now, when that happens, it will be visible, you will be able to see it, but you'll also realize an unexplained weight gain, and that is from that excess fluid that you are retaining. Also, don't you remember, activities take a lot of energy, and if your heart is not supplying oxygen to every organ system that needs oxygen to do those tasks, it becomes difficult and tiring, and you can experience fatigue, weakness, and shortness of breath in those situations. And the brain is one of the areas that need a lot of nutrients and oxygen to stay vital, to help you with thinking, concentrating, etc. And now there's not enough oxygen that is flowing through the body and the brain, and so you may have troubles with concentration and memory, etc. as well. So knowing these symptoms are important so you can pick up any signs, especially the fluid retention one is one that you'll see quite immediately. So you may be prescribed medications. So medications are aimed at decreasing your blood pressure. And this will decrease the amounts of work that the heart has to do, as well as increase your blood flow so that other organ systems can get oxygen and nutrients that it demands. You may also do surgical procedures, and this aims at treating the underlying cause for the heart failure, or doing a transplant if the heart is too damaged. And lastly, you can change your lifestyle. You can change your lifestyle. And this could generally be through cardiac rehabilitation. This includes diet change, so eating healthy, more vegetables and fruits, etc. And exercising. The exercises are generally aerobic or endurance type of activities, so walking, running, jogging, swimming, etc. You want to get your heart pumping, get blood flow to every area, and that is one of the best ways to strengthen the heart. Also, you want to decrease stress. Stress does have a negative effect on the body, specifically the heart in this case. And lastly, if you have any other comorbidities, you want to make sure that you do take your medication correctly so that you can prevent being diagnosed with heart failure. Now, because the body is made so crazy and there's connections everywhere and all this, when one system is affected or starts to fail, other systems are affected and may start to fail as well. And with heart failure, the two systems that are mainly affected is your liver, and this can lead to liver damage. This is generally because of the fluid retention in the belly area, as well as your kidneys, and this can lead to kidney damage. And this is because they're not getting enough oxygen and nutrients to stay vital and do their function. So it is generally caused by the risk factors of heart disease that cause heart disease that can lead to heart failure. Yes, so risk factors such as age, high blood pressure, high cholesterol, family history, obesity, diabetes, etc. can cause heart diseases such as coronary artery disease, heart attack, stroke, etc., which can lead to heart failure. And so risk factors of heart disease indirectly cause heart failure. So you want to address those first to prevent heart diseases, to prevent heart failure. So to prevent heart failure, you want to address the causes of heart failure. So if you have high blood pressure, taking medication as prescribed to decrease your blood pressure will help, because then your heart won't overwork. If you have diabetes, taking your medication correctly may help as well, because you're not putting too much strain or damage towards the heart area. Making sure that you exercise. Your heart is a muscle, and all muscles need to be strengthened to stay strong, vital, and to keep you young and healthy. So exercises that are aerobic or of endurance type is what you want to do. That will help in strengthening the heart and getting blood flow throughout the entire body effectively. So going for a brisk walk, jogging, running, swimming, dancing, you name it. Anything that gets your heart rate up and keeps you nice and young and strong. But remember, it does take time, so do start at your own pace. Then eating healthy. A lot of unhealthy foods cause damage to the arteries of the heart that can cause a heart attack, which can cause heart failure. So you want to eat healthy, make sure that the body's getting the right nutrients that it needs to stay vital and strong. Decreasing stress is important, guys. Stress is a problem in life. You need to make sure that you do that. A nice walk outside does help because it changes your scenery. Meditation is another way. Yoga does work in exercising and trying to decrease stress. So making sure that you do that as well will help your body in the long run. Thanks for tuning in, guys. If you have anything that you want me to clarify, do leave a comment and I will get back to you as soon as possible. Also, like this video, share it, and subscribe to my channel if you have not already. Hope you guys do have a great week. I'll see you soon. Bye.